to call the doctor or notify the provider. Unlike the previous question in which you were asked to identify which assessment would require the nurse to call the primary care provider, a very common distractor suggests that the nurse should call the client's care provider as one of the answers. What is a primary care provider? The primary care provider could be any health care giver who has either admitting rights or prescription rights. That may include the client's doctor, physician, surgeon, nurse practitioner, or physician's assistant, just to name a few. But keep in mind that a response that requires the nurse to call the doctor is rarely the correct option. There is almost always an action, either an important independent or autonomous appropriate assessment or immediate intervention that the registered professional nurse should take prior to calling the doctor. When confronted with questions with "call a doctor," look very carefully at other options and ask yourself, is there something here that the primary care provider will ask me about? Will the primary care provider ask me for that assessment? Will the primary care provider ask if I carried out that action yet? If your answer to either of those questions is yes, then that option is likely the correct response rather than calling the doctor. Let's take a look at an example. First, let's separate the case scenario from the stem of the question. The case scenario tells us that the nurse in the newborn nursery notes that 4-hour-old neonate just admitted from the labor and delivery recovery room has hands and feet that are cool and slightly blue tinged. The stem of the question asks us, the appropriate action at this time is to finish the data collection. Let's identify those critical elements. The key words are 4-hour-old. The client is the 4-hour-old neonate. The issue is the appropriate care of a neonate with slightly cool, blue-tinged extremities. The type of stem is a true response stem. Now we can start to look at and eliminate distractors. Option 1. Swaddle the neonate in blankets. This option will be assigned a plus sign because we know that it is important to keep the neonate swaddled to conserve heat and promote feelings of security. We will come back to choice 2 after we have considered the other options. Option 3. Place the neonate on oxygen. We will assign a minus sign to this choice because we know that the findings describe acrocyanosis, a typical and expected assessment in a 4-hour-old neonate. Option 4. Put the neonate in an isolate. We will assign a minus sign to this choice because we know that the findings describe acrocyanosis, a typical and expected assessment in a 4-hour-old neonate, and does not require to be placed in an isolate. Option 2. Notify the primary care provider. We will assign a minus sign to this choice. We have already identified an independent action that the nurse can take, as well as noting that the assessment is not unexpected in a newborn. Now we will also consider the call the doctor response using our strategy. If we were to call the doctor, what would the doctor say? So if we notified the newborn's primary care provider that the newborn had acrocyanosis, what would the primary care provider say? They would likely ask if we had swaddled the infant and were keeping the infant warm to prevent cold stress. So in this question, we have an assessment which is not unexpected and does not need to be conveyed to the primary care provider, so we go with what we know and choose choice 1, swaddling the neonate in blankets. Are you ready to try one on your own? Okay, here is another sample question. In this drill, I would like you to practice eliminating distractors using the strategy we just learned about calling the doctor. Let's separate the case scenario from the stem of the question. The case scenario tells us that the nurse is caring for a female client on strict bed rest recovering from a lumbar laminectomy. By the 3rd postoperative day, the client has been advanced to a regular diet. On the fourth postoperative day, the client states she is not hungry and refuses her dinner tray. 3 hours later, the client complains of nausea and asks the nurse for an antiemetic. The stem of the question asks us the nurse's first action is to. Let's go ahead and identify those critical elements. The key word is first. The client is the fourth postoperative day client. The issue is the sudden development of nausea in a client on strict bed rest. The type of stem is a true response stem. Now we can start to look at and eliminate distractors. We will come back to choice 1 after we have considered the other options, beginning with option 2, auscultate for bowel sounds. This will be assigned a plus sign. Since this is appropriate to make for a client experiencing sudden onset of nausea after 4 days of bed rest, we know that according to our strategy, the nursing guideline of nursing process, we must always assess the client first before intervening. Let's look at option 3. Check the date of the client's last bowel movement. We will assign a question mark. It is also appropriate for a client who has complaints of nausea and is on strict bed rest, but we are not sure that it is the first assessment to make. Option 4. Administer an antiemetic. This will be assigned a minus sign. It may be appropriate to give an antiemetic to the client complaining of nausea. However, we know that according to our strategy, the nursing guideline of nursing process, we must always assess the client first before intervening. Now, let's come back to the first option, our call the doctor choice. Notify the client's physician. We will use our strategy. If we called the physician, what would the physician say? We know that a postoperative concern related to back surgery is an ileus, and that 4 days of bed rest greatly increases the risk of the client developing an ileus. The sudden onset of nausea is a potential manifestation of ileus, and an ileus can be detected by the absence of bowel sounds. Therefore, if we called the physician is likely to ask, did you assess the client's bowel sounds? So we go with what we know and choose choice 2, auscultate the bowel sounds.